Hi viewers, welcome back. In today's video, we are going to discuss about the scope of nursing. The scope of nursing or the aim of nursing is divided into 4 areas. Okay, the first thing is your promotion of health and wellness, and then preventing illness, restoration of health, and the care of dying patient. Okay, so what is the first point means? Okay, see, nursing, the basic or the essential thing in nursing is caring. Caring is becoming the basic part of nursing. You would have come into nursing with different thoughts, like most of you would have said, like, I want to give patient care, I want to help the sufferings, I want to serve the society. So you have lot of like avilashas or like wishes, like when you enter into nursing. Okay, so but when you are thinking about nursing, it comes or it circulates the 4 areas, these 4 areas. Okay, so the first point is your promoting health and wellness. So what are we doing in promoting health and wellness? So always I say my students, see, if you want to talk, always go and talk with patients, not among you. Okay, so talking is something, a great experience the patient feels. Okay, so what are we going to talk? So we are not going to talk about their family issues, our family issues, nothing regarding cinema, nothing regarding politics, nothing. Okay, so 100% we are going to talk about the promotion of health and wellness. Okay, so whatever you talk, whatever you see, whatever you are doing, your basic concept is like you are going to prevent illness. Okay, so for that only you are going to help the society or the individual or the family to improve the health factors. Okay, so promoting health and wellness. So what are we going to talk? So you are going to talk about, like, first basic thing I always say, like, you have to collect history of the patient. Okay, so collect history of the patient. So when you collect the history of the patient, you can't go and tell the history of your family. Okay, just enter the ward, say hi, how are you, had your food, how do you feel today, how is morning, somebody came to see you, had your food. So you just talk. Okay, then you start collecting the history, in the sense like from where do you come, who all are there in your family, who is the earning member, how much is the income, like how do you are you vegetarian or non-vegetarian, which culture you belong, like that you keep talking. Okay, so you will get an idea about the family. So now our part begins, like you are going to give health education regarding the promotion of health. So okay, so what you are going to do, you are going to talk about the diet. So how the diet factors are going to improve the health and thereby preventing the diseases in the family. Sometimes there are families where they have hereditary diseases running. Sometimes there are non-communicable diseases running in the family, that includes your diabetes, hypertension, or like your cardiovascular diseases, something will be there. Okay, so when you start collecting history, you will have an idea. So once you get an idea, you can give education or you can give counseling regarding the diet or the lifestyle modifications. Okay, so lifestyle modifications, when you come for lifestyle modification, your next point comes, like where you are going to prevent illness. So what are we doing in preventing illness? Okay, so preventing illness is, first point is like giving education regarding the maintenance of health. So to maintain health, what all we are supposed to do? So what type of food we have to take, what we are not supposed to take. So tell the patients regarding the improvement of health through nutrition, that is like to prevent taking fast foods, tinned foods, canned foods, preserved foods, these to be avoided. Tell the patients, the family, to take nutritious food, direct sources from the nature. Okay, seasonal fruits, vegetables, and whatever like our forefathers had, okay, like cereals, pulses, importance of all these nutrients. You have to tell them about the vitamins, minerals, micronutrients, macronutrients, everything to the patients and their importance and what they are going to do for the health, that is to maintain the health or wellness. And thereby, like once you avoid these junk foods and these fast foods, definitely you are going to prevent illness, okay. So that you have to tell. See, nowadays the ratios of your non-communicable diseases are to the core, okay. So you can see like even a 12 years child, 15 years child diagnosed with diabetes, okay. So you know what are the factors, your lifestyle, they are influencing the cause of these diseases. So you have to emphasize on the lifestyle modifications. You have to tell them what type of lifestyle they have to take. Active lifestyle, daily doing exercises, mild walking, nice healthy diet, meditation, yoga, keeping themselves relaxed, positive attitudes, like praying. So whatever it is their culture, maybe a Hindu, Muslim, Christian, whatever it is, like let them see the higher spirit, okay. So somebody above us, okay. So you have to believe on that higher spirit. So praying, all these things make you stable, your mind becomes more stabilized, okay. So with that you will be having a lot of positive attitudes and positive thinking, which is definitely going to prevent illness, thereby quitting all your bad habits, that includes your smoking, alcohol, watching TV, that also you can add with your alcohol and smoking, because like watching TV, again it is a bad addiction, like which is going to cause lot of negativisms, okay. So kindly try to avoid, or otherwise, like if not to avoid, you can have a restriction on your screen timings, okay, and kindly tell your children to reduce the screen timing less, because like I can't tell, you can't go and tell the child to do that, because when the parents do, the children they follow, okay. So parents kindly they can avoid, so that the children they will follow the same. So again it is our role, what we are going to teach the community, how they can decrease the screen timing periods. Let them have active lifestyles, okay. Let them go outside and play, let them have indoor games in playing, let the parents play, let them tell stories, talk, communication, encourage the children to talk, encourage the children to have an outlet. So whatever happened in their school, whenever they travel, what has happened during their traveling time, these all can prevent problems in the life, okay. So these things can prevent illness, okay. So preventing illness, you will be targeting on the factors to avoid and to promote in the lifestyle areas, okay. So your lifestyle becomes a major part, okay. So lifestyle modifications you are going to concentrate, which is going to improve your health and thereby preventing illness, okay. Then the next point of the restoring health, actually everybody thinks this is nursing, okay. So where the exact nursing care comes, okay. So restoring health, like after the illness has occurred, so already 2 steps has been gone, that is your maintenance of health and preventing illness. 2 steps we have left, we have come to the 3rd step. If these 2 steps have happened, we cannot see a patient in the 3rd step, that is like your illness step, okay. So your caring area. So what are we going to do? Restoring health, okay. So it is always like nursing is like, many people think nursing is something just following the orders of doctors. Never ever think like that, okay. Nursing is not just following the orders of the doctor. We are the people who are standing with the patients 24 hours. No doctor stay backs with the patient 24 hours. Nobody can make a judgment on patient, or nobody can do an assessment on the patient more than you. You are the people who are going to assess the patient more exactly. If the patient is becoming sick, you are the person who is going to rule out easily, first you will be diagnosing the condition. So you must have that knowledge, you must have adequate knowledge regarding a disease condition, so that you will be able to identify the condition in the early phase. Okay, so identification becomes a major part. So when you are coming to restoration of health, first part is identifying the patient is going in for complication. Then comes the management part. Okay, so you are identifying how a patient is becoming sick. There is some modification with the vital signs, there are some modification with the behavior, some modifications with your physical assessment. You come to a conclusion the patient is becoming sick. Okay, so you rule out that something abnormality is going on, then you report to the doctors. So nurses as such, we don't have like ethical rights to describe or prescribe medications to patients. So first assessment we will be doing, we can do nursing assessment, and then that can be documented to doctors in the early phase. Our ultimate aim is saving patients. Okay, so this saving patient, if in case if it is our target, we will be able to rule out these conditions very easily, and you can prevent the complications of the diseases. Okay, so you rule out the patient is becoming sick and inform the medical team. So once the medical team is informed, they will be having a critical analysis on the patient, what drugs to be given, what procedures to be done, what investigations have to be done. All these things the medical term like the team is going to decide what is going to happen for this patient. Okay, so first part of assessment we are going to do. Then comes the assessment, and then comes the exact care. So exact care includes your administration of medication, giving injections, like oral medications, like taking care of the patient in the sense like providing bath, back massage, your procedures of your catheterization or NG tube feeding, or your cannula, taking care of an IV cannula. All these things, all these are like small nursing procedures you get, where you will be doing everything with love and affection to the patient. The difference between a medical team and a nursing team is like medical team they treat, but what we are going to do is like we are going to help them come back to their normal phase. We are going to give them love and support so that they come back to their previous stage. So our role is very important. So always do things with smiling faces, help the patient to recover or come back to their previous stage easily with lot of love and care. So that is with your restoration of health for the patient. Okay, then finally the care of dying. Okay, so the important role of a nurse during the death, that is like how do you take care of a patient during death. Okay, so it is a separate topic that we will be dealing in detail. Okay, so just I will tell you how you will take care of a patient who is going to undergo a death. Okay, so most of the time you can predict deaths, that is like maybe within 2 days he will die, within 1 day, maybe within half an hour. So all these things you can be able to identify, you can have an diagnosis like how long it can take. Sometimes it is unexpected, like where we cannot have an idea like what is going to happen, everything would have happened very fast, but most of the time you will have an idea. Okay, so in case the patient is having a systemic infection, you will have an idea how many days the patient will survive. Okay, or otherwise like in case if the patient is like a chronic ill patient, you will have an idea like how many days he can survive. So it differs with the patient. So whatever it is, you are going to see the exact phases of your death. Okay, so how a death is going to happen, how you will be able to face the death. Okay, so it is very difficult task when you see the mother crying for her son, the son crying for mother, the father crying for children. So it is a very painful task. Okay, so you are going to stay back in all these areas. You are not like the medical team who is just going to write the death register, who is just going to sign and leave the area. You are going to accompany the patient, accompany the family members where they are going to see the exact phases of death. You are going to accompany. So, it is a very painful task where you have to be very assertive, very calm and quiet. You have to know what you are supposed to do when there is a death taking place. Okay. So, that's what I said. No, it is a great big topic that we will deal in detail. Okay. So, just to have an idea. Okay. So, the aim of nursing falls under this 4 categories of the promotion of health, preventing illness, then the nursing care, the exact restoration of health, and then comes the care of a dying patient. So, with this we are finishing the aim of nursing or the scope of nursing. Okay. So, you will have a bulky idea what is nursing as a whole, what is our role, what are we going to do. Okay. So, in the next class we come up with a new topic. So, until then, bye, take care.